Hello, this is Larry Lacrosse with Catholic Human Services and Alpena Fire Department Auxiliary. You all do important work on behalf of the public, which is often very rewarding but can also bring challenges from stress, exposure to traumatic situations, and emotionally charged situations on a routine basis. During September, we take some time to focus on mental health, suicide prevention, and recovery, and that includes all of us. I'd like to take a moment to highlight three of the most impactful things that we can do to improve and sustain our emotional and mental health. And they may be surprising because none of them involve therapy or medication. The first is sleep. Most American adults do not get enough quality sleep, which is the way our brain and body repair and recharge. Poor sleep can contribute to lack of focus, increased anxiety and depression, increased stress hormones, and increased physical health problems. On the other hand, getting quality sleep has both an immediate and long-term effect of improving mood, reducing anxiety and depression, and significantly improving our overall physical health. Often the key to quality sleep is creating an environment and getting into the habit. Dedicating enough time to rest, preparing for sleep, reducing stimulants like caffeine and nicotine later in the day, and removing distractions and barriers to sleep helps us to set up and allow our brain and body to do what it knows to do naturally. The second area is exercise, which has been demonstrated in many studies to have a very significant positive impact on mental and physical health. This includes significant improvements in mood, reduction in depression and anxiety, improvements in resilience to stress, and of course, physical health. Regular exercise has a dramatic positive impact over time on all areas of physical health and one of the most important forms of therapy for chronic pain. The key to exercise is to find one or two things that are within your abilities and enjoyable, and to create a routine of repeating these several times a week. Length of time spent is less important than frequency, and even as little as a few minutes per day or 15 to 20 minutes several times per week can have a dramatic impact. A third area for emotional and mental wellness is cultivating healthy connections to others, especially outside of our work. The more we are connected to family, friends, church and faith communities, social activities, and shared hobbies, the more we will experience the positive benefits of enjoyment of life and buffer the effects of stress and trauma exposure. Healthy connections often help us to process difficult experiences, finding meaning and purpose in experiencing gratitude, fun, and joy. I find that when someone recognizes a difficult moment in their life, their first call usually isn't to a therapist or counselor. Instead, we seek support in our friends and family. Sometimes, however, we may experience more persistent problems, and counseling can be very effective, even on a short-term basis. Mental health care is health care, and we can help ourselves to recognize when something isn't going well and seeking the right kind of help. Signs and symptoms related to emotional health typically include a change from a healthier experience to not feeling well. These can include things like distraction at work, poor sleep, lack of appetite, more anxiety and irritability, feeling kind of foggy, lack of interest in normal activities, family and friends, lack of motivation, feeling tired, more frequent sadness, depression, or sometimes even thoughts of self-harm or suicide. These symptoms, as well as others, whether in yourself or someone you know, are signs that there may be a more significant need and should be evaluated by a doctor or mental health professional. We are lucky to have a wide range of effective therapies, including short-term interventions, that can provide relief and get you back to life. In our community, we have the benefit of a wide range of trained and qualified therapists at organizations including the following: Alcona Health Center, Catholic Human Services, Behavioral Health Services at My Michigan Medical Center, Northern Waters Counseling, Northern Therapeutic Services, Thunder Bay Community Health Service, and many others. Any of these services can be contacted by calling them directly, and often they don't require a referral. Catholic Human Services can be reached by calling 989-356-6385. I want to thank each one of you for the important work you do on behalf of the Alpena community. Thank you, have a wonderful week, and go Wildcats.